Interestingly, the same way that you can't feel having high cholesterol, you can't feel that your statin is working. And so patients really have to rely on blood tests to know how effectively their statin's working. If their LDL is not lowering properly or enough, we'll either increase the dose or switch to a different drug. When we start a statin drug, I will then probably repeat a blood test on them in about 1 to 2 months to see how well their statin is working. And if it's working effectively, great, we can repeat the next one in a year. But if it's not lowered as much as I'd hoped, then we can talk about increasing the dose or even switching to another medication if there was really no effect. You start on an initial dose of statin based on your cardiovascular risk profile. Some patients will need a moderate intensity statin, while others will need high intensity statin therapy. And then we talk about how we can increase the dose or change the dose over time if they need it, and what other options are available if that dose doesn't achieve the target we're looking for. So when I start patients on statins, while most patients have a really robust response to medical therapy and we see a significant reduction in their LDL, some won't achieve that goal and they feel very disappointed in it. And I tell them, it's okay, take a breath, we're gonna increase your dose and we'll follow up in 2 months. This is not an emergency situation, right? This is something that we can do over some period of time and work it out together. So we could increase the levels. If we repeat it again and it's still elevated, then we can move to other drug classes and choices like PCSK9 inhibitors or siRNA messenger RNA drugs. The best doctor-patient relationships come out of working together. And often it takes some time to really build that relationship and have them understand why I'm recommending what I'm recommending. And there is some trial and error, but usually it always works out that we come up with a solution that really treats their cholesterol well and that they're happy about and that they tolerate well.